Teresa Dampf is a former EMT driver and has been working as an ER and ICU nurse since 1998. She has witnessed how aggressive organ procurement teams can be at convincing families to agree to organ harvesting. One situation in particular involved a young girl named Jasmine. After her pancreatic surgery, her liver was damaged by an overdose of acetaminophen. Her brain swelled and she was declared brain dead. Jasmine was an organ donor, and the procurement team quickly stepped in and started pressuring her mom, Anna, for organ harvesting. But Anna wanted to give Jasmine time to possibly heal, and she didn't want to be pushed unless Jasmine was truly dead.
They were watching to see when all her support system had left, and they were going to turn around, and if they could have gotten her to break and say, okay, do what you want to do, I believe they would have set up the operating room team and they would have taken that girl out of the room.
And harvested her organs?
Yes, yes. That evening, another doctor who was actually one of Jasmine's personal doctors, he came into the room after a whole day of surgery, and he basically said, you know, Jasmine signed a donor card. And her wishes were that when she died, that she would donate her organs. And I looked at him and I said, yes, but doctor, when she signed that donor card, was it informed consent? When she signed the donor card, was her definition of death and organ donation the same as yours? Well, her family understood organ donation, giving your organs after death, would be that she's removed from the ventilator, she stops breathing, her heart stops, they say their goodbyes, and then you are allowed to take her and take her organs. And the doctor looked at me and he said, well, he goes, then her organs would be useless. Nobody does that. And I said, you know that, and I know that, but I said, she didn't know that when she signed that card. I started asking friends and family, and I mean, I'm saying people with college degrees and very well-educated individuals, what did they understand about donating organs after you're dead? Many, if not most, did not understand that they are taking you breathing with your blood pumping, with everything functioning, and then they cut out your organs.
Dr. Paul Byrne practiced medicine as a neonatologist and pediatrician for 55 years. He's currently the president of the Life Guardian Foundation and works to inform people about the troubling diagnosis of brain death. Throughout his career, he has seen an increase of the diagnosis as a means for organ transplantation, and he fears not enough people are aware organs must be harvested from a donor with a beating heart.
Brain death, of course, was invented. They had started to do heart transplants, but they realized that they were not successful unless they got a living donor. Every heart that is transplanted is a beating heart that is stopped first and then taken out for transplantation. The heart without oxygen in 4 to 5 minutes is so damaged that you can't transplant it. The liver, likewise, in 4 to 5 minutes is so damaged that you can't transplant it. So they have to get these organs while they have circulation.
Would you say that most people think that the organs are harvested in the hour or so after the person officially dies?
Of course. Who would think that they would be taking organs from a living person? It's written on our hearts to protect and preserve not only our own life, but the life of people that we love.
What do you think is the incentive of the hospital to declare somebody brain dead so that they can harvest their organs?
Financial. I have to have a transplant. I'm waiting for a transplant. I'm ill. I have a liver issue that if I don't have one, I'll die. Just my surgery alone, I've already been quoted $500,000 just for the liver. So can you imagine if they get a patient's body that gives the corneas, gives, a heart, gives a lung, and they don't give the patients time enough. It's generally around 3 days, unless the family fights it. They want those organs within 3 days. EMTs know that they're directed, when there's a brain injury or a head injury, they're directed to the trauma centers. The trauma centers have a little thing going with the procurement centers, and the procurement centers will know that that they're going to declare that patient brain dead before the family knows that they've declared them brain dead. And so they will come in sometimes before the family's even been talked to about that and ask if they would give the organs of their family members.
Bobby Schindler is the brother of Terry Schiavo and the president of the Terry Schiavo Life and Hope Network. While Bobby believes in the good that can come from organ donation, he also cautions people to educate themselves and challenge the brain death diagnosis.
I think they need to do their diligence or due diligence and educate themselves on this whole organ donation program. I think it can be a good thing, so to speak, but I think it's been corrupted. There are situations where a person can use the organ donation program to help. It can be helpful, but I think people have to be very careful and really do their best to educate themselves on whether or not they want to be an organ donor.
Jenny Hammond was a registered nurse for 12 years. In 1985, after a series of seizures, Jenny fell into a coma and was declared brain dead. Her husband refused organ harvesting for Jenny, and she woke up 3 weeks later. As the former executive director of California Nurses for Ethical Standards, Jenny has seen many cases where doctors and organ procurement teams make decisions that don't necessarily align with their oath to do no harm. Jenny, how does a brain death diagnosis for organ donation align with a physician's oath of do no harm?
It's in very poor alignment because they're not looking at doing no harm to this one specific patient. They're looking at deliberately harming one patient for the benefit of another patient, and we're not supposed to do that. With limited resources, we might have to sometimes in triage choose who gets the resources, but at no point should we deliberately harm another person for another one's benefit.
Would you say the physician is intentionally, deliberately harming that patient, or? In some cases. In my case, I believe that yes, the physician was deliberately looking to harm me for some sort of benefit. I think that he knew that my coma was drug-induced, and he was taking advantage of that as an opportunity to procure organs. Through the work that you've seen with Terry's network, have you seen a trend in the medical community where they're turning more away from valuing human life and preserving it to instead ending it?
Without a doubt. It seems to me decisions are being made with what is in the best interest of the hospital rather than what is in the best interest of the patient. So every day we're seeing it more and more where patients' medical rights and families that are advocating or trying to protect their loved ones are being eroded more and more every day. And there's been a shift where these hospitals, these ethics committees, these doctors are now in position or have the power, so to speak, to make medical determinations and whether or not a person is going to receive these types of treatments rather than family members. So you have strangers now making decisions where families once were making decisions with what was in the best interest of the patient or their loved ones. Well, we're seeing this whole quality of life mentality, I think, permeate our healthcare system today. Decisions are being made that are in the best interest of the hospital's bottom line rather than what's in the best interest of the patient. We've been involved in cases where, and know of cases, that if a person is just given time, given a chance at rehabilitation or therapy or something, does improve, and does improve significantly. When someone experiences a profound brain injury, it doesn't have to be a death sentence. We have to do what we can to change that paradigm and get people to understand that these people, more than anything, need ongoing and constant rehabilitation and therapy. We saw in my sister's case, where they were saying, well, no rehabilitation is going to help her, There's no therapy that was going to improve Terry's condition, which is completely contrary to all the evidence that's coming out now when it comes to people with these types of brain injuries, like similar to Terry's. So people need to educate themselves. They need to learn more about brain injuries and how these people can be so helpful to us to learn more how to not only treat people with these types of brain injuries, but to also care, love them, and show the compassion they deserve.